Good morning, everyone. Myself, Dr. Pragyan Paliwal from the Department of Conservative and Endodontics. Today, we are going to speak about the elastomeric impression materials and the non-elastomeric impression materials. The elastomeric impression materials are the materials which are in the aqueous hydrocolloid, non-aqueous elastomers. The aqueous hydrocolloids further divided into agar and alginate, and non-aqueous elastomers are divided into the polysulfide, polyether. Agar. Agar is a reversible hydrocolloid with a ADA specification number 11, and chemically the agar is an organic hydrophilic hydrocolloid polysaccharide which is extracted from the seaweed. Alginate, an irreversible hydrocolloid. It is a linear copolymer and which is widely used in our dentistry. This is the composition of the alginate, having the potassium alginate as a soluble alginate and calcium sulfate as potassium as a reactor. The measured powder is mixed with the water in a clean rubber bowl. The powder is incorporated into the water and mixed in a vigorous figure of 8 motion. This mixing gives us a smooth, creamy mixture that does not really drip off the spatula. The setting time can be altered with the water powder ratio and by altering the temperature of the water. In this, the powder is mixed as we can see in the figure and mixing with the rubber bowl, loading it into the tray, and the impression can be taken. A complete impression after the removal of the mouth is shown here. When the alginate impression is taken, the following factors has to be considered. That is, the perforated tray is there. Whatever the excess material will come out. Any movement during the gelation may result in the distortion of the impression. The dimensional stability has to be kept in the mind because it may result into the syneresis or imbibition. If at all the more imbibition, the water may get incorporated into the impression and may get swelled up. So the cotton wrapped into the properly squeezed should be kept in. The clinical application, it is used in the impression making when the undercuts are there. It is also a good impression can be recorded in the mouth with excessive flow of the saliva in the partial dentures, and also for making the preliminary impression for complete denture in the study models and making cast and the duplication of. The advantage is that it is easy to mix and manipulate, minimum requirement of the equipment, accuracy, low cost, comfortable to the patient also, and it's hygienic. As in the different flavor also, the alginate is available. This advantage cannot be electroplated, distortion occurs easily, poor dimensional strain and poor tear strength. Nowadays, the patients which are having the respiratory problems, even the dusterless alginates is also. Some specific alginates are also available in the commercially, that is with the chromatic alginate, which shows the indication of the setting with the color change. Disinfection is very essential to prevent the cross infection. Some disinfectants are there which are easily incorporated into the alginate itself, that is chlorohexane, bisphenols compounds and ammonium chloride. The non-aqueous elastomeric impression materials are also available. The elastomers refer to the group of rubbery, polymeric, and elastic and rubber-like property. They can be easily stretched and rapidly recover their original dimensions when the applied stress is released. Good dimensional stability and elasticity is compared to any other materials. These are the polysulfide, first to be introduced in 1950. The main component of the polysulfide is mercaptan. These silicone or rubber-based impression materials developed to overcome some of the disadvantage of the polysulfide based on the polymerization reaction. They are of the two types, that is condensation silicones and addition silicones. The condensation silicone is available in the two-phase system, that is in the putty system. This is developed to overcome some of the disadvantage of the polysulfide, that is the poor order, long setting time, and high permanent deformation.